In today's episode, we're talking about life in the NICU, what parents need to know about vision and retinopathy of prematurity, and how to navigate the journey. Stick around as Kathryn shares her story and what she wishes every NICU parent knew.
They found some discrepancies on the ultrasound, and so we knew that we were going to have a NICU stay if we could make it to birth, but we didn't know how long. He was teeny tiny, just full about a little bit, 3 pounds and change. But on day 9, he got necrotizing enterocolitis.
Oh my gosh, that's so...
And that just really complicated, for lack of a better word. You just learn how to advocate, you learn how to ask questions. And my husband looked at me and he said, I think you need to say it's okay to let people help you. You have to admit that things really are hard and they really are bad and you need some help.
Welcome back to In Focus, the podcast that brings clarity to your family's eye health and your life. I'm your host, Dr. Rupa Wong, a pediatric ophthalmologist. Joining me today is someone whose voice has become a guiding light for so many NICU families, Kathryn Whitaker. She's an award-winning author, a national speaker, and the host of 2 NICU podcasts with Hand to Hold. But more than anything, she's walked the NICU road herself. When her son Luke was born prematurely, he spent 14 weeks in the NICU, with Kathryn suddenly needing to navigate surgeries, setbacks, and all the emotions that come with having a medically fragile baby. That experience sparked a mission to help other NICU families feel more informed, more empowered, and far less alone. Today, she brings that same mix of empathy and hard-won perspective to everything she does, whether she's talking to parents or clinicians. In today's episode, we're talking about life in the NICU, what parents need to know about vision and retinopathy of prematurity, and how to navigate the journey. Thank you so much for being here today, Kathryn.
You're welcome. I'm happy to be here.
I'm glad we could do this in person. It's so much better.
I know. I never get to do this. This is great.
I know.
This
it's
is
fun.
good.
I mean, I know I did your podcast and we're doing mine, and we're going to help educate and empower so many parents about this whole journey and what to expect, because I see it from one side, and I think it's so important for those parents that come to my platforms to be able to see the medical perspective, to learn about your side of it, because there are resources out there and things that are really important for them to know to take care of themselves. So,
I mean, so many more than when I was there. Tons more resources.
Well, partly because you've built a couple there.
We've
right?
done a couple, yeah.
Yes, you have. Okay, let's just get started. So your story as a NICU mom has touched so many families. You've lived through it all, that whole heartache, the high stakes world of premature birth. I know when I come in just for the brief exams that I'm doing for the eyes, you hear the beeping. I know that my office manager, she had premature twins, and she got PTSD almost from that. So can you just tell your story? Tell us what it was like when Luke was born, that experience.
Yeah, so we went in for the 20-week ultrasound because I was advanced maternal age.
Oh, you gotta love that.
The geriatric
pregnancy. Yes, I was too for my 3rd. I was too.
So I just thought this was my 6th pregnancy, 5th live birth. And so I just thought it was going to be normal. They found some discrepancies on the ultrasound. And so we knew that we were going to have a NICU stay if we could make it to birth, but we didn't know how long. Mm-hmm. And then we were 9 days into our NICU stay. So he was a relatively easy birth in the sense that he came out screaming, and he was teeny tiny, just full about a little bit, 3 pounds and change. But on day 9, he got necrotizing enterocolitis.
Oh my gosh, that's the worst.
Which is an intestinal infection that eats away at your bowel, and when your bowel dies, it doesn't come back. And that just really complicated
everything,
for lack of a better word, all the things. And then we found out over the course of our stay that he had abnormalities in his brain and his heart and his kidneys and his spine and all the other things. And so over the course of the first 4 years, he had 10 surgeries and 18 specialists. And that very first surgery that he had for necrotizing enterocolitis, he had a 2 in 10 chance of surviving. And so last fall, he turned 15. So I'm always like to tell people the happy part of the story.
Yes.
But it's been a journey. And through all of that is how I got connected to Hand to Hold, which was the national nonprofit that kind of helped us navigate all the hard spaces and places.
So you were, remind me again, he was born at how many weeks?
He was 36'3".
36'3".
But a little over 3 pounds.
3 pounds.
So about the size of a 32-weeker.
So the size of a 32-weeker, and then all these complications.
Yes.
All these systems that were involved, and then you spent 3 months.
Yes, that first year, it was brutal. I just kept thinking we're never going to, we would leave the hospital and then something would happen and we would land back, or we would go in for a routine surgery. I mean, relatively.
It's
And then we found out on surgery number 5 that he had a hemolytic reaction to cephalosporin-based drugs. So his kidneys were shutting down, and it was getting worse with each surgery. So it took a beautiful hematologist that figured it. She said, let me get a bottle of wine and I think I know what this is.
Let me mull on it.
I'll come see you in the morning. And she said, I think we figured it out. But it just felt like we were never going to escape the vortex of the children's hospital. But we finally did. And about 4 years in, things started to settle at least a little bit. We'd done all the therapies, you name it. We did it, hundreds of hours of those. And I finally found my feet again. And then I got pregnant with our 6th baby. But it also, I was a vastly different mom with Luke and subsequent children than I ever was before that. You just learn how to advocate. You learn how to ask questions and be curious.
Okay, this is what I want to talk about. But first, just even being in the NICU, it's so emotionally draining. There's all the roller coasters in terms of all the diagnosis you're getting thrown at you. There's so much uncertainty. How did you navigate those challenges?
Well, some days not very well. I mean, I spent a decent amount of time. So we were in 2 NICUs. So when he got NEC, we left the children's hospital, or the hospital that we were at, and we got transported to the children's hospital. So one was a Bay Area, so we were in an open setting. The other, we were in our own private room. And while that was good, it was also really isolating because there was no one else around us. And I spent a lot of time crying in that room. But I had some really great nurses who introduced me to hand to hold, but also I think gave me permission to, like, I call it embrace the suck. Like, it's okay to let it be painful and hard, and you don't have to like happy clap your way out of it. And so I think I learned to just own, like, if today was hard, it's okay to let it be hard. And then if tomorrow's good, like, let's rejoice the fact that no new specialists were gained today. We got to just be a normal NICU baby today.
Yes, you didn't have to see one of us, a new person. I mean,
yes.
we love people.
I would rather meet y'all at like the grocery store than I would at the hospital. So I think that was part of it. And then I will say the first probably 3 weeks that we were in the hospital, I had 5 kids under the age of 8.
Oh my gosh. I had 3 kids under the age of 4, and I felt like my brain was, I don't know, I can't barely remember.
It was a lot.
I cannot. And
And then one in the NICU.
One in the NICU.
And I was trying to do it all. I'm a type A, I can do all the things mom. And then many days in a row, I kept falling apart. And my husband looked at me and he said, I think you need to say it's okay to let people help you. And that was really hard for me because you have to admit that things really are hard and they really are bad and you need some help. And for me, I think it was incredibly humbling to let people bring us meals, to let people pick my kids up from school, to let people help my kids with their homework or carve pumpkins. Or I just kept feeling like I was leaving the NICU and I was letting my NICU baby down because I wasn't there as much as I wanted to be, which was 24/7. I wanted to, but I couldn't. And then I was leaving my other kids down because they were there. So I was crying in both places and it was just hard. And so I think I learned it will be less hard if you will just let people help you, and you will someday get to pay it forward.
And isn't that interesting that as women, we feel like that is superhuman. You cannot.
I know.
It's not possible to be in all the places,
so
but
amazing.
but not. I mean, I think women tend to do that. We tend to think we should do this. This is the way that it needs to be, and we have this guilt.
And I was a failure as a mom. Not only did I fail in the pregnancy, these are things that we tell ourselves. And I was failing in my marriage. We ended up in marriage counseling a few months later. I was failing as a mom. Just all the ways in which you can fail. I was like, I'm getting an A+ in failing.
And then how did you get out of that mentality? Because
I had some wise moms who were around me. Some who were. I found that I was connecting with moms who had been in the NICU before that were friends of mine, and I had no idea that they'd had a NICU stay and they were reaching out, Kathryn, or they'd been in a similar life-altering situation, whether it be a cancer diagnosis or something else, and they're like, you can do this, but here's how you're going to navigate through it. And so I started finding these little lifelines along the way that were kind of giving me hope, like, okay, it's not always going to be this hard. I'm also not going to stay the same person. I'm going to change. I'm going to grow. I'm going to get wiser. And I'm going to start asking for help, and he's going to get better. We're going to sort of get our cadence down, like things that felt very foreign. Like, for example, the first time that they gave him an IV and they had to put it in his head, in his scalp,
It's terrible.
all the good veins,
it looks
right?
terrible.
But I had a panic attack and I went to another room and I was like, I can't do it. Fast forward 4 weeks later, nursing students come in our room and I was like, oh, let me show you.
Like, where's the good vein over there?
And I was the person like breathing, in a paper bag trying to feel like I wasn't going to faint. And then 4 weeks later, I'm showing nurses how to put in NG tubes and do all these things that I never thought I would be able to do. And it was all because when you love your kid, you just get over yourself. And so I think the love was greater than my fear. And I learned, okay, I can do this, and we're going to do it imperfectly for a while, but I can't do it by myself because I don't have the skills to do it by myself yet, but I will someday. So I think that's how I got out.
I love
just
that.
One day at a time.
Doing it imperfectly.
Yes.
We don't need to be perfect. And then just...
Also hard for a type A mom.
It is.
So
Is
that you? Is that you too?
Speaking of one, I know. Okay. Yes, my husband's like, just don't do that. It's like, no. I need to bake the cookies and do the thing and take the kid over there to that place across the island and do it all. And yes, when your child struggles, obviously having a premature child was not your fault in any way.
No.
At all.
But it sure felt like that for a long time.
And that guilt, just you were able to alleviate it through your network,
Yeah, and then I think when he was heading into surgery number 5 is when things started to fall apart at home. And a really great friend of ours, she had 3 children through foster care, all have special needs. And she came up to the hospital and she said, Kathryn, it's okay to ask for help, like professional, outside, third-party help. Mm-hmm. You're not a failure. And I think it was because of her example. And I had seen her life. I knew the challenges that they dealt with on a daily basis. And I thought, well, if Angela's telling me to do that. And so I looked at my husband and I said, so things are burning down between the two of us. We have no time together. What your perspective is and my perspective are 2 very different things. I'm a nurturer, you're a provider, and this is not working. And so we went to marriage counseling, and it taught us a lot about communication.
Yes.
And giving ourselves grace. And I think I feared, Dr. Wong, that if I didn't do things well, that I was going to damage my other 4 children.
Right.
And I worried, like, if I don't do this well, that they're going to be the fallout as well. So I'm not only going to fail with 1 kid, but I'm going to fail with all 5. But we fast forward all these years, and kid number 4, who was 2 when Luke was born, is now going into special education because of her brother. Aww. So my kids, I think,
just got goosebumps.
Became better people because of this really hard thing that we happened, because I think the thing that I tried to protect them from was the thing that formed them. And if I could tell anyone anything, don't fear the hard stuff, because some really good fruits can come from that. It just may take a while for you to see it.
And that was what I was going to ask, was what kind of advice would you have for other NICU families? It is stressful. It's stressful on the other children, whether or not they're old enough to really understand. It's stressful for a marriage because you're trying to manage. I know so many of the parents are sleeping there as much as they can. Where I am, sometimes Neighbor Island, if they're on Maui or the Big Island or Kauai, they don't have these level NICUs that they need.
Right.
The babies get transferred, and so one parent comes, so they're apart.
Brutal.
For months from their other children. What advice do you have for people, that are navigating this?
I think I kept trying to live in the future. Like, I kept trying to say, where are we going to be in 3 months, instead of just like, where am I today? I kept sort of living in this place, this imaginary place that I had hypothesized all these horrible things were going to happen. And I was like, okay, so I can't fast forward 3 months of what it's going to look after we have spine surgery, for example. But instead, today, we're going to do today. Mm-hmm. And if we're in the PICU today, then we're going to do the PICU. So I had to really get very local. Like, I had to say, okay, just what can I do well today? What's the next right thing that I can do? And then tomorrow, if I have to fall apart, I will, and then we'll cry, and then we'll do the next right thing. But I think I had to stop living so far in the future and be much more present. And I think it helped me appreciate some of the little things, like some of the little milestones that he would hit when he was in the NICU, or it felt little, or it looked little, but boy, did it feel big when he would like eat Cheerios and instead of, just throwing up at the table. Like, we were able to like navigate to a new thing. So I think it was just a matter of not trying to go too far, and instead just stay like, where are you today?
Where you are. And that's
because you want to get to discharge.
I'm always future. I mean, and I've never been a NICU mom, but I'm still always future casting. Like, oh, well, 6 months from now we're doing this, and this is what our life's going to be like that, and I don't
This
know,
is what happens when you try
type
to
A in us.
control.
I'm not sure. The planning, right?
It was the control part,
It's like control, and you have no control in the NICU.
Right. And I think before the NICU, I said, okay, if I can do A, B, and C, then I will prevent D, E, and F.
Of course.
And when you have to relinquish control, you have to say, well, today I think I'm just going to do this one thing. I think I'm going to focus on this instead of trying to do what happens next. And when you can do that, you can be present to the person that walks in your room. I had a great conversation with she was on the janitorial staff, but we had been there so long, we practically knew each other on a first name basis. And she came in and we just had this beautiful discussion, and then it never would have happened if I had been just micromanaging and figuring out, like, when is he going to eat? When are we going to do this? When are we going to do that? And instead I got to just take a pause and be like, well, what lesson am I going to learn from the person that walks in the door? Or you start to get, your advocacy starts to grow because you look around and say, well, I don't know that we need to do a vital check at 3 a.m. So I'm going to tell the nurse to say, hey, just put it on the chart. I've excused it. You don't need to do it. He'll be fine.
Yes.
And then we were able to get like 3 or 4 hours of sleep at the hospital. Which felt like a spa vacation.
Yes.
But I learned when we could do that and when I needed to say, okay, yeah, let's do the checks. But you only learn that because you're there so long, and you get a chance to connect with either other parents or other medical professionals and be like, okay, this is when I need to push and this is when I need to listen. And it's just a little bit of a dance that you start to learn. And I wouldn't have learned it if I hadn't learned to relinquish control. So it has sort of morphed into things in our house, because I used to be the mom that had like the Pottery Barn house. Well, it wasn't Pottery Barn. It was like Target chic, but like Pottery Barn house. And now I'm like, it's fine. Someone's shoes are out. It's fine. And my mom, she's like, who are you? I said, I know, but I had a NICU baby and these things don't matter. Yes. Like this matters, but that doesn't matter.
But that doesn't matter.
So
it
you
just
learn.
puts it, like you said, into perspective.
I'm still, like, if you were to ask my husband, he would still say that I'm very much in control, but I've learned what to be obsessed about and what not to be obsessed about.
Because I still need a clean home to feel like I can think.
100%.
I just cannot. It drives me absolutely nuts.
Yes.
I'm trying.
Hey, it's all a journey. So it's all a journey. It's fine.
Is there something that you wish someone could have told you to prepare you? I mean, you just gave great advice to kind of be present in the moment, which can feel really hard, I think, especially when you're in the NICU and there's so much going on in the moment. Yeah. I'll go into the exam rooms, and we would always round at 7:30 in the morning. And I felt so bad because sometimes I'm waking up the parents,
right?
And because they're trying to get some sleep, and I always go with a nurse who was a former NICU nurse, so that was great. And she would kind of close the curtains, and then I would go in and I would just say, "I'm Dr. Wong. I'm going to be examining the baby. You probably don't want to see this anyway because it's really traumatizing for a lot of parents. I personally didn't want to see it when I didn't even want to think about it when I was pregnant with my kids, and then I do the exam. But I just feel like there's so much coming at you at all times, right? And then sometimes the main NICU team is trying to get in there. And then in IDs, even just when I'm trying to do my exam, the infectious disease person, I was going to draw blood, but I see you're doing an eye exam. And my exam's 5 minutes long in there. And there's so many people, so I can't even imagine being there for an extended period of time. Yeah. And that day in and day out, do you just get numb to it? Do you just feel like, you realize what you need to let go?
Well, I think that I just learned that was our normal. And I don't think I realized the fallout until months later when we would like go back for another surgery. And then it would be like, oh my gosh, that's super triggering, because you just get into survival mode. So you just sort of shut down the things. It's sort of like Maslow's hierarchy, right? Like you just focus on the things that you know that you need to do to survive. Right. And it wasn't until months later that I realized how hard it was. I think I'd give people two pieces of advice. One is, you should have someone with you to write down notes, because I had a notebook and I would occasionally do things, but our nurse said you should leave a notebook in your room. And anytime you think of a question, whether it's general or for a specialist, write it down. And then if you're not here, then we can ask the question for you. But it was also helpful because my brain, I was thinking, I'm dialed in. I know what they're saying. Right. But it's highly traumatizing and it's highly stressful, and there's a lot of anxiety, and you will forget things. Mm-hmm. So to have someone who doesn't cost you extra anxiety to be there, like they're comfortable in a medical setting, I can't manage manage your feelings too. I'm going to need you to lock in and be normal because I can't do this with you. Okay. So having someone, and my person, her husband was a doctor. And so she was like, she was a cancer survivor. She's like, I got you. So to have that person, really helpful. And if you can't, you can call the patient advocate. You can call the chaplain. It's okay to call a chaplain. That's what they're there for.
I never even thought of suggesting that.
Yes. So ask someone at the hospital, say, hey, this is really hard for me. I need someone to take notes. And I think I also learned that particularly on the day that he had to have the surgery where he had a 2 in 10 chance surviving, I looked at our NICU nurse and I said, I need you to be in the OR with him because I need someone that I trust. Mm-hmm. It's not that I don't trust a surgeon who I loved. He ended up doing 5 of Luke's surgeries. But I said, I need someone that I know is at his bedside. And she said, Kathryn, I've never been in the surgery before. And I said, well, you're going to go because I'm going to get permission from the doctor, but I need someone in there. And she said, I'll do it. So I think it's okay to ask sometimes for maybe the thing that you don't know if they're going to say yes to. And our surgeon looked at me and he said, would that make you feel more comfortable? And I said, yes. And he said, then that's what we'll do. So I learned to just ask. And then we would go through a period of negotiation. Like what makes you feel comfortable? What makes me feel comfortable? And let's find a happy medium. And sometimes they would say yes, and sometimes we would negotiate. But it gave me a little bit more of that control. Like I know someone's in there that cares about him as much as I do. So.
And how could you be an advocate in a way that actually got things done? Does that make sense? I don't know if that question. Because sometimes people feel like they're advocating. I know I do this now, not in any level as what you needed to do, but just even with my kids, they'll complain, oh, well, the math teacher didn't give me my time and a half for my ADHD. I'm ready to send that email. And no, I don't want you to do it. I'm gonna take care of it. Or sometimes they have to, obviously not in your case, but sometimes there is a mama bear instinct for many of us. And so my kids, now that they're older, will say, Mom, stop. I don't want you to do anything. Obviously, Luke couldn't tell you, Mom, stop. Right. And there are times when you needed to abdicate, sometimes not as much so. And I would feel like if I was in your position, I'd be ready to go like all day long. Well, back then I had blogs were super popular. So I would come home and decompress. So I would come home and I learned that if I wrote it down, not only did it help me remember what was happening and then maybe I could share that with whatever specialist the next day, but it also helped me process because this was really hard. And while some of that went public, it's off the blog now, so don't worry. But some of that was public at the time, but some of that I would write in other places because I needed to get it out. And so that was really helpful for me. And I think in our podcast that I do with all of our NICU professionals, I'm learning so much. There was something that one of the specialists that I spoke with, she said her ENT sat her down and said, what can I do so that this is less scary for you? Oh, that's a great question.
And because her experience with a certain procedure that her son was going to have, another friend of hers had had it and their baby had passed away. And so she said, that was my only experience with that particular procedure. And she said, and the ENT knew enough about that to say, what do you need to know so that we can make the best possible decision instead of being like, why are you being difficult? Why do you not understand? Because people are rarely being difficult. Yeah. They just don't understand. And so when you have from the specialist side, if they can say, what do you need from me? And as a parent, if you can say, this is what I need from you, or this is really scary, or this is really hard and I don't know. Because many times it would be a life and death situation to be like, we're going to give you a couple minutes to think about it. And I'm like, okay, I need a second because when Luke went in for surgery, my husband was at home with the kids taking the shower that he hadn't had in 3 days. No. And they're like, we need an answer in 10 minutes. And so it was incredibly stressful. So I think the recognition of what you have to voice what you need. And sometimes that's writing it down. And then I think specialists have to be open to saying, hey, maybe we do this every day, but they've never done this.
Yes. And it's I think sometimes it's just a little bit of a check.
Yes.
For the physician, the nurse, whoever it is, because it can feel so routine. And they talk about it, I'm sure, a million times a day. I know when I need to go in and do the retinopathy, prematurity lasers, or even just the exam. Like I'm going in and usually I'm doing 20 exams in a morning, right? I'm just going boom, boom, boom. And I'm checking, it's fine. 90% of the time it's fine. 90% of the time I don't find anything. But I also know that as a parent, they're sitting there like holding their breath to see
because you don't know what's normal and what's not normal.
Is it better? Normal. Is it worse? Do they need surgery? Right? I know But I don't think I appreciated that until I was a parent. And I don't think I was a bad doctor before I was a parent. I mean, it was only a couple of years before I became a mom. But I think it gave me that level of empathy. And I think what you just said, that the ENT surgeon said, that's such a great thing. I'm just going to tuck away. And maybe
really
if someone in healthcare is listening, they might tuck that away too. Because when I do find if someone seems as if they're being difficult, it's not. They're not being difficult. They're scared. They're scared. And it's our job to allay that fear.
Yeah. And I think it was something that one of our NICU nurses said. She now trains other NICU nurses, and she said, I'll remind my nurses that you're working on somebody's hopes and dreams. Like, this is somebody's child who they have, we had a lot of hopes and we had a lot of aspirations and dreams for Luke when he was first born. And then it feels like someone just not just pulls the rug out once or twice, but like every single day. And so everything that you thought might happen, and then you start to think, well, then this could happen, and then that, and you start to live in the future. So it feels really overwhelming. So to have someone I remember they did family-centered care. So they would round as a group. Mm-hmm. And I remember our neonatologist would look at us, and before he started anything, he was like, Kathryn, how does Luke look to you today? He started with me.
Oh, that's great.
And that made me feel like, one, I felt valued, but he was like, legitimately, no one knows your baby better than
100%.
you. So he's like, so we're going to start with you.
Yes.
And it felt to me like, okay, so we are all on Team Luke here.
Yes.
And it was such a small thing, but it felt very big.
That's a big, it's a small thing for them to say. Again, just a
little thing.
Just a little thing, but you're seen.
Yes.
And I always say, you know your child the best.
Yes.
We get these snapshots. Even if they're looking at all the labs and the blood pressure and the heart rates over 24 hours, we still just get a snapshot of your kid in the NICU, and you're with them. You know them.
And then now we have NICUs, and I know them really well, but they were an instrumental part, I think, of our stay. And while not every specialist and every interaction was positive, I learned how to advocate and be like, you know what? I know that nurse may be learning, but I don't think it's a good fit. So if you could find us a different nurse tomorrow, that would be great. I would be grateful for that.
Were you worried when you said something like that? Oh, I'm going to be labeled as trouble. I'm going to get worse care, or they're going to, I don't know, disregard the call bell or something.
Maybe, but I think my mama bear instinct was like, I don't really care.
Yeah.
This is my baby, and he's the only Luke that we get. And so and he can't speak for himself.
Yeah.
So if he needs me to stand up for him, then that is what I'm going to do. And I will say I led with love. I would be like, I'm sure they're a great nurse, but it's not a good connection. So if we could find a different one, and the hopes that maybe the next NICU family that they met, or maybe the way that they reacted, they might react differently the next time.
Then just give them a little feedback. You're saying it in a...
I tried, and I recognize
really nice
that
way.
even if I hadn't said it in a nice way, I'm a walking trauma bay here, so I'm going to ask you to excuse that. But I think, at least in the NICU, I do think that there's sort of a level of general awareness of, we're going to give everyone a little bit of grace here. And I found that to be true in the patients that I saw that were also milling the halls. But sometimes it's not. And so you have to just speak up, because no one else is going to do that but you.
I think that's so important, because there's a way we always have to advocate for our kids through life. I think so.
And I learned how to navigate when I was talking to insurance companies. Oh, that's a whole other podcast.
Yes, it
is. So you learn how to advocate for that. I've learned how to advocate for my other kids in school settings or in sports teams or whatever. And I learned so many things. I tell the child life specialist, I was like, y'all helped me learn how to be a better parent, because there's so many things that I learned that have been extrapolated and used in so many other areas of my life, that the NICU didn't just change our family medically. I mean, it reverberated and changed us in every possible way. And I like to say in the best of ways, like, I think we took the best of all that, and our family is this because of that. And so we didn't waste it.
That perspective is really amazing. I don't think necessarily everyone
It
would
took a
have
long
that.
time to get there.
Okay,
We're 15 years in.
Well, and that's also good to know. This wasn't on month 3 that all of a sudden you're like,
no, I wanted to burn the NICU down on month 3. I was like, I'm done with this.
We've
Yeah,
got
100%.
So
it was
we
hard.
know. I mean, when you were there in the NICU and going through it all, and just having those heightened emotions and really feeling everything that happens, what resources are available now that probably weren't 15 years ago that other parents, that you wish the parents knew about?
I mean, definitely podcasts were not, they were sort of an up and coming thing all those years ago. So to hear other parents' stories, to be like, is there another mom that's dealt with ROP? Is there another mom that's dealt with this? And what did they do? Yes. So podcasts are one. Hand to Hold, I'm a huge fan of theirs. They have a beautiful website.
So tell me about Hand to Hold.
So it's handtohold.org, started by Kelly. Easy name to remember.
Yes.
She has 2 preemies, a 24 and a 34 weeker. And she sort of felt like she was floating on an island. And she said, there's got to be a better way. And so the bread and butter of what Hand to Hold does is connect seasoned NICU parents with current NICU parents in a mentoring relationship. And you don't have to live in Texas to access that. It's nationwide.
Oh, okay, wonderful.
The podcast, obviously, you can check. Yes. It's called NICU Babies Parent Support.
I'll put it in the show notes for people.
And they also we have bereavement services. There's counseling, depending upon what state you live in. And it's all free. You don't have to pay for any of that. Amazing. And all those connection points, whether it's the mentorship, whether it's, hey, I left the NICU and my baby did not come with me. So what resources are there for that? My husband is struggling. We talk a lot about NICU moms, but what about NICU dads? Also, what about NICU siblings?
Yes.
How to navigate if you are a NICU grandparent. So they have so many resources like that, whether it's articles that you can read, people that you can connect with, or things that you can listen to, like podcasts while you're in the NICU or while you're driving back and forth. Those are all sort of easy access points. And then depending upon where you live, there's some in-person things too. But I think more than anything, it connected me with moms that I could say, okay, so I'm not alone. Mm-hmm. Because as great as the NICU is, it is the most isolating place I have ever been in my life. Mm. And I had to find some lifelines. And so Hand to Hold sort of gave me some of those tools to be able to get to the other side.
That's so wonderful that you contribute now so much of your time.
I love it. I love it so much.
And your energy to bringing this to other NICU parents. And I know that it helps them.
I hope so. It has been an unexpected surprise. I wasn't expecting it to be so fulfilling. And I love visiting. I visit with parents. I visit with doctors and specialists. I visit with chaplains, counselors, like you name it. I've talked to them. And everybody's story is beautiful and unique, but it's also really empowering to be like, okay, I was not the only one that did this.
Yes.
And we all made it to the other side. But the sort of congruent thing that happens with all of us is that we all asked for a lifeline somewhere. We didn't do it by ourselves. And so it's good affirmation, I think, if you're looking for that.
I love that. Thank you so much
You're
for
welcome.
being here today. I really appreciate it. I know this story, your honesty and transparency and sharing it with us and all the work you've done since then really is going to help so many people. So I really, really, really appreciate you taking the time. Where can people, you mentioned Hand to Hold, are there other places that people can find more about you and your work?
Yeah, so Hand to Hold, they're on all the places and spaces. I'm Kathryn Whitaker TX, so I'm on Instagram, Facebook, really not Facebook, more Instagram, and then my website's kathrynwhitaker.net.
Thank you so much.
Thanks, Rita.
Thanks for joining me on In Focus. If you found today's episode helpful, I'd love for you to share it with a friend, leave a review, or hit that subscribe button so you never miss an episode. For more tips on eye health, parenting, and staying focused in a busy world, follow me on Instagram at Dr. Rupa Wong or head to drrupawong.com. Until next time, keep your vision clear, your priorities focused, and your family thriving.